Have you ever gone in for, say, a CT, an MRI, or even some lab work, and then the provider came back to you and said they found something that they weren't even looking for? That is called an incidental finding. And an incidental finding is kind of like finding something by accident, but it's not a bad thing necessarily. It is, if it turns out to be something life-threatening, say if you go in for some abdominal imaging and they find that there's something like wrong with the aorta, let's say, it's a good thing that they found that. It's an incidental finding that would save your life in that case. Another example is my sister just recently who went in to have MRI, CT, had some imaging done of her hip because of hip pain. And incidentally, they found something on her ovary, which resulted in her getting further workup done, seeing a GYN oncologist, and having major surgery. Incidental findings are very common, and with the way imaging is today and how sophisticated it is, that leads to more things that are found by accident. If a finding such as a nodule, a cyst, a mass, something that they weren't looking for is found, so therefore they have an incidental finding, it might lead to something that is absolutely benign and irrelevant, or it might lead to, as I said in my sister's case, where you are followed up by a specialist and that person then will take over by giving you a consultation. Regarding cancer, the last statistic I could find was in the United States, 2 million people each year, according to the American Cancer Society, are diagnosed with some type of cancer. And 70,000 of these diagnoses were the result of an incidental finding. I will link below the information that I received that statistic from, plus some other things that might interest you. As I always mention in my videos, knowledge is power. It's okay to ask questions. Make sure that if your provider talks to you about an incidental finding, don't just think, oh, it's benign, and I guess they would tell me if there's a problem with this new finding. But it's okay to say, what do we do now with this accidental? My cats are acting up. Ask your provider what to do with that information that you just received. What are the next steps? And I know one time a provider said to me, what do you want me to do with this back pain with your adolescent son? What do you want me to do? I said, I would really like to start with an x-ray. And that's when she talked to me about incidental findings and that we really don't, I think it's fine. We really don't want to jump in and do things because we're just going to find something. And lo and behold, they did find something. But it was nothing that was life-threatening. It wasn't an issue, but that was probably my first experience of someone in our family having something that was found by accident. Always speak up, always ask questions, and if you're interested in tidbits about health, oopsies in healthcare, myths and facts related to healthcare, please consider subscribing, and I'll see you in the next video.